Thank you and welcome to this edition of the medical school involvement and identifying the priorities that are necessary for our community. I'm here now with none other than Dean Robert Johnson, who is the Dean of the Rutgers New Jersey Medical School, and with Dean Amy Murtha, who is the Dean of the Robert Wood Johnson Medical School. And in conjunction to the changes that have been made in the medical school structure, the two of them are going to be developing the strategy on how a merge can happen in relationship to the campuses that are part of the New Jersey educational environment. Thank you, Dr. Johnson. Thank you, Dr. Murtha.
Thank you.
For giving us an opportunity to be able to challenge this escapade, because we know that there's so many things that have been going on in this environment. And when it comes to identifying the true direction, it's always best to go to the people who know the answers. And we appreciate you on this day, the birthday of Dr. Martin Luther King Jr. And we're talking about freedom, and especially when it comes to healthcare. Healthcare is one of the major obstacles that we're having even now with the way in which people are being cared for. And we know that the University Hospital and when we were the University Medical School, there were a number of changes made, and now many of them are being created for a better community. And so the thing that I thought would be very helpful for us is to sit down and have a dialogue about it with the two of you. Let's start with Dr. Murtha.
Okay.
Give us an understanding of who you are and how did you evolve into this whole thing?
Yeah, I appreciate the opportunity first to be here. So thank you so much for inviting us and having an opportunity to share with you some of the work that we're doing. So I'm an OBGYN by training. I grew up actually in Rockland County, just over the border from Jersey. Med school in Philadelphia, and then trained at Duke University for OBGYN and was there for some time, and then was the chair of the Department of OBGYN at University of California in San Francisco. In 2022, my husband and I knew we needed to be back east, and Rutgers came knocking. And what I saw for this opportunity for the medical school, the Robert Wood Johnson Medical School at that point, the merger had been talked about but not finalized, was an incredible opportunity to build something special for a state that really, I think, deserved a premier academic health system, a health structure to provide the best possible care to the citizens of New Jersey. And all of the pieces of the puzzle to create that are here. It's about actually pulling it all together and creating that success. So it was a very attractive opportunity for me to move my family back east. And then the merger decision came after that, which I think has been an interesting and exciting opportunity to see how we can really elevate the work that's happening on both campuses.
Excellent. And Dr. Johnson, let's get your idea of how everything evolved with you and being involved.
Well, you know, I've been around for a very long time. I went to medical school at New Jersey Medical School. I entered medical school in 1968. At that time, the school was in Jersey City. And as many of you know, there have been a number of things happened that resulted in the medical school moving to Newark. And I moved from Jersey City along with that and came to Newark first in 1969.
Wow.
And graduated from New Jersey Medical School in 1972. Eventually went into adolescent medicine. I trained in New York, came back, and I started practice in adolescent medicine in Newark in 1976. And for the last 50 years, I've been taking care of teenagers and young adults here in this city. Now, along with all of that, I became chair of pediatrics and then eventually dean of the medical school. and I've been dean of the New Jersey Medical School since 2005. So I'm like the longest serving dean of medical school in the United States. Now, a lot of things have gone on, and New Jersey had a situation where UMD&J had 2 medical schools, and a lot of that has to do with the economy of the state, the economy of the schools themselves. But when UMD&J put everything together, we had 2 medical schools, one in New Jersey, no, in Newark, one in New Brunswick. And one of the things that occurred was that the schools were competing with each other. We were part of the same institution, but we competed for faculty, we competed for students, we competed for research, we competed for philanthropy. And that was never to the advantage of UMD&J. In 2013, I was already dean then, UMD&J was broken apart, and we all became Rutgers. And so Rutgers ended up with 2 medical schools. University Hospital, which was originally part of UMD&J, became a separate entity. So in Newark, we had a contract, an agreement, an obligation, in fact, state law that required that New Jersey Medical School be the main teaching facility, its main teaching facility be University Hospital. And so we've been involved closely with University Hospital for years. But still, Rutgers then now has 2 medical schools that compete with each other. And as Dr. Murtha said, one of the things that the university decided to do about 2 years ago now was to combine those 2 schools. There'd be 1 medical school with 2 campuses. A campus in Newark, a campus in New Brunswick, but it would get rid of the competition. It would allow us to be the 2nd largest medical school in the country and allow us to benefit from the size in education, clinical care, as well as research and philanthropy.
Dr. Murtha, yes. Robert Wood Johnson, Rutgers Medical School, University Hospital. Clear that up for me.
Robert Wood Johnson Medical School, New Jersey Med School, University.
And the first thing you need to say is, I'm not that Robert Wood Johnson.
He's not that. He's Robert Johnson. There's no Woods in the middle. I think it's Robert L. Johnson.
The reason why I asked that is because we know that they are all separate entities.
Right.
Yeah.
And I believe that is what we're trying to cultivate.
Yeah. So first to say, as Bob just suggested, Rutgers University has 2 medical schools. Mm-hmm. It's very unusual for a single university to have 2 medical schools. And the reason why is because they compete with each other. Mm-hmm. So those are 2 separate medical schools, 2 separate accredited medical schools. We have a accrediting body that we're responsible to. Mm-hmm. And right now we sit under 2 different accreditations. Just that work alone is an enormous amount of things that need to be done to accomplish that accreditation, and a lot of redundancy within Rutgers University just for the accreditation alone.
Okay.
University Hospital is a separate entity, although legally is the teaching hospital for New Jersey Medical School. That is not going to change. That remains completely the same. What will happen in the merger is that Robert Wood Johnson Medical School and the New Jersey Medical School will become one medical school, the Rutgers School of Medicine, with 2 campuses. They'll have 1 single LCME, Liaison Committee on Medical Education, accreditation. So instead of 2 accreditations, it'll be 1. And what we've realized through this work is that the way that we've competed with each other has been really detrimental to both schools. And as we start to bring the communities together to understand each other, we're more similar than we're different. We care about very similar things, and together we'll be much stronger.
In many aspects, when you consolidate, sometimes you let go.
Nope.
Well, what I'm trying to say, I guess in so many words, is that what about the staff?
Yeah.
How do we relate to this whole complex that you're clearing up in accreditation?
So I'm going to go, Bob.
Yeah.
So I would just say first that I've been at a couple of different organizations to understand operationally and administratively how medical schools work. Mm-hmm. I think both medical schools have historically run themselves on a very thin administrative margin. Mm-hmm. So there's not a lot of redundancy in administrations within each of the schools. Oh. So we already run pretty thin. bringing the schools together, there's opportunities for us to think about how we partner and collaborate. And Bob and I have been very, very specific and intentional in saying this is not about layoffs. This is not at all about anything to do with that. This is about making our school better. And I think the operational efficiencies that we will see and realize from working together will be to the better for both campuses.
I think it's reasonable for people to fear that a merger is going to lead to downsizing. That's not what we're doing, because we have two institutions that are separated by 35 miles. They have to be largely the same.
Yeah.
And so we're not planning to decrease departments, decrease faculty, decrease staff. Those two things will work together. And the process we're undergoing now in creating the documents we need for the accreditation has brought our faculty and staff together.
Yeah, together.
And they're beginning to work more and more together to begin to develop this the way we'll operate. But no, we're not going to downsize.
What is the vision in terms of what are we looking to find beside the fact that we're going to be not competing?
Right.
We're going to be developing a way in which the structure is going to be more efficient.
Right.
Mm-hmm.
But what will be the outcome?
Well, the most important outcome for medical school is students. The reason we are a school is because we train physicians. And so right now between us we have 700 and...
No, it's more than, it's like 1,200 actually.
1,200 students,
yeah.
Right? And we will continue to do that. And it may very well be that the merger will allow us even to expand that a little bit. So we will be producing doctors for, well, hopefully many of them will stay in New Jersey, but we will be producing doctors. That's the most important vision. If we weren't producing students, then we could be something different. Now, in the process of doing that, we need to make sure that we are producing physicians who have the knowledge and the skills as well as the mindset to work well with our populations in New Jersey. And one of the things that we need to make sure of is that those students understand how it is to work with people, how it is to make sure that everyone has equal access to health care and has equal access to excellent outcomes. So that's really our vision. Now, along with that, we do research. We do a lot of research. And I've personally been involved in the AIDS epidemic and the research we've done there, and the COVID epidemic and the research we've done there. We do a lot of clinical care, University Hospital and Newark and Robert Johnson Medical School. So we do all that clinical. We'll do all of those things too. But the most important thing we do is we train students. And that is the vision, and we want to make sure that we have students who are outstanding individuals.
I've had a conversation with President Jimenez in relationship to the redevelopment of the hospital itself. How does that really become something that is going to complement what you're doing?
Oh. Well, University Hospital is our primary teaching facility. You know, I saw University Hospital built when I first came here. It was not there, and the university, we were in the old Martland building, and we need to have excellent facilities to provide the best care, but also to train the best students. So the construction that's going to go on at University Hospital, especially expanding the emergency room, improving L&D, developing new ambulatory facilities, developing new OR facilities, will allow us to train students in an environment, students and residents, quite frankly, in an environment where they can learn and provide the best care.
And if I could just add to that too, I think it also helps us to recruit top-notch faculty.
Right. Okay.
The top-notch faculty to train the students to do the research, to do the things that will make us who we want to be.
There's also some development that's going to be made in the structure for the schools.
That's right.
Let's talk about that.
That's right. Yeah. So there's planned renovations. So there's planned, and Bob's probably better to talk about this than I am, but there's planned renovations for the medical science building on this campus. The liaison committee on medical education requires that the campuses have equitable or equal student services and resources. That means that there needs to be some campus upgrade here. And in New Brunswick, we have actually a split campus. So our first and second year students are in Piscataway, and the third and fourth year students are in New Brunswick. So we're really split, which is not really the way that you build community. There's a building underway that will move the Piscataway campus to New Brunswick, so we'll all soon be on that same campus. It is a new building. It then actually sets the standard for what has to be done here as well.
Okay.
And that's the work that's happening here.
Yeah.
We know that that's actually moving forward.
Yeah, so the renovation of this building at the medical science building will do a number of things. One is that the internal workings of the building, the HVAC system and all of that, that needs to be upgraded because that goes back to the 70s. Then we need to upgrade research laboratories that are part of the building. But we also need to upgrade educational structures, and so that will be part of that upgrade. So that will be done. In conjunction with University Hospital, we're also upgrading ambulatory care facilities and the interim buildings that are on 12th Avenue and Bergen Street.
Interim buildings that were put up.
Yeah. Well, that's where I went to medical school. Those buildings that were supposed to, they're now 50 years old.
But they were
those are coming down. And,
Truth be told,
yeah, and you should actually.
they have functioned so long.
They have. Oh, I'm going to actually take a piece of them.
Oh yeah, right.
They're going to actually start coming down in the spring.
Yeah, in
spring
March,
this
I think,
year,
yeah.
and there'll be a new building going up over there.
Okay, and there will be a new building going up.
Oh, yeah.
Several.
It's
Yeah,
gonna have
Several new buildings.
several new buildings
Yeah,
going up.
they're
That's
coming
gonna
down. We're moving things around to accommodate them
Okay.
coming down so that they can begin the construction.
Yeah.
So we are looking in terms of building more opportunities for employment for people in the local community.
Yeah.
Developing a way in which you can continue the excellent service in your trauma unit.
Yep.
The Cancer Center is definitely
Yep.
someplace that a number of individuals have found wonderful quality services
Yes,
from.
indeed.
The benefit of having a school incorporated into a regular environment of healthcare is really important.
Right.
And if there was a question or a way in which that we can make sure that our residents know that there will be priority here in Newark through the medical school, how can we really find the right message?
Yeah, so I often think that the words can relay the message, but until you see action behind it, you don't really believe it to be true. So I think evidence will begin to be demonstrated by the interim building starting to come down, by the construction happening in the medical science building, by us actually moving our work forward in a way that that others can see in a physical way. Because I think that demonstrates that the commitment to Newark is solid.
Right.
That we're investing money in this facility because we're here and we're committed to being here for the long haul.
Right. One of the other things that, the best reason to believe that we're going to do a good job for the people of this city is what we've done already. And it's half a century of activity. Now, I don't want to say how old I am, but I've been here doing this. And so, we had in this city teenage pregnancy problems.
And we're saying half a century is 50 years.
50 years, 50 years, 50 years.
Just to be specific.
Teenage pregnancies, lead poisoning, measles immunizations, HIV, COVID. All of those things have been improved and addressed by this institution, the University Hospital as well as New Jersey Medical School. We are provide that care. And the other thing is that we are not only just providing the care, one of the things that was part of the commitment we've made is to improve the ability of citizens of this city to go into medical school. And so we've had these pathway programs that have been actually about 30 years of pathway programs, and they're now stronger than ever. We have students from the high schools in Newark who come and work in our laboratories, getting exposure to research. Students from Newark Rutgers who are coming into our school, getting exposure to research and careers in medicine. So those are the things that we've been doing for many, many years, and we're going to continue those things.
I think the other thing just to say is it's been remarkable to hear, and Bob and I have been speaking to different departments, to different stakeholder groups, to faculty groups, to students, and consistently, there's a deep commitment to the community. In fact, in one of the groups we met with a clinical faculty group, and actually this messaging was same from Robert Wood Johnson as it was from and New Jersey Med School. Whatever you do, do not disrupt our commitment to the community. That commitment is the most important thing to the faculty. So it's just evidence again that we're here for the community.
The thing that I think is necessary that we should discuss is the improvements that are going to be made. Let's start with women's health.
Let's do it.
What type of improvements do we think is going to be evolved?
Yeah, so this is a space that quite clearly is near and dear to my heart, and I will say I've been working in the Nurture NJ space, which is Tammy Murphy's initiative, actually also helping the doula group as they've been working on a project for Newark, it coming in a few months actually, and also in the midwifery space. There's a lot of work I think that still needs to be done in New Jersey to improve maternal health outcomes. We have persistent disparity in a range of outcomes in maternal health space that need to be attended to. In Robert Wood Johnson Med School and in New Jersey Med School, in my opinion, we need to develop midwifery programs, midwifery support, group prenatal care. There's a variety of very specific obstetric programming that has been shown to be patient-centered care that provides high-quality care, improves access, and actually improves pregnancy outcomes. That space is really important to me, and I just touched my microphone. And I am a fierce advocate and have been working and have had fortunate to have the opportunity to spend quite a bit of time with the OBGYN faculty here, so I can learn a little bit more about what's happening here, what the needs are.
Right. The care that we provide for the people of the city of Newark through University Hospital is closely connected with University Hospital. Our doctors, our faculty, are the doctors at University Hospital. And so we can't expand programs without doing those things in partnership with University Hospital. So one of the most important things that University Hospital does is provide emergency care. It's an outstanding facility for emergency care and trauma. And the expansion of the emergency room, which is actually going on now, we're expanding that, is going to significantly improve the access of citizens in our community for care more quickly. So that's one thing. The other thing that needs to happen is that facilities and things like obstetrics, for example, we need new facilities. As those facilities are expanded, it will improve our ability to do that. Another thing is there are all sorts of new technologies that are developing in medicine. And the development of our new program, new school, will allow us to bring in experts in some of those areas. Bariatric medicine, for example, minimally invasive medical care, and all robotic medical care. All of those things will be able to become more available to the citizens of our community as a result of the partnership between University Hospital and Rutgers University and the development of a broader faculty.
It's been almost a decade since the last time you and I had a discussion. And we talked about HIV, which was really prevalent in our community. We've gone through COVID. But I do know that you have a pet peeve with pediatrics. And you were talking about a children's hospital.
But a love. A love for pediatrics.
And you really was adamant about how important it is for us to focus on children's health. Are you doing anything in that area?
Well, hospitals are important, but most people never go to a hospital. They don't. You know, many times people think about the health of the community. They said, well, I'm really happy that a hospital is around the corner, but just think about it. You only go to a hospital when something catastrophic happens. Your health, however, is something you live with every day. And the quality of your health is really dependent upon what you eat, what you do or don't smoke, what exercise you get, what the environment is like. It also depends on the economy and all sorts of things like that. So the most important thing we do to improve health for people is the ambulatory care. And so when it comes to children's care,
Okay.
the hospital is important, but it's the thousands of kids who come into our clinics.
Right.
That's the most important thing. And our education of parents, our education through schools, all those things. And those are things we are doing and continue to do. So, and working with the city to do some of those things, like improving the water, for example, all of those things. So, and then immunization, which is another one of the things I really care a lot about.
Yeah,
So,
but, Doc, you danced on that.
Yeah.
What are we gonna do about a children's hospital?
well, we have a children's hospital.
Right.
Yeah,
we're going to build it. It's going to get better.
Well, remember, Newark's had a children's hospital since 1895.
Okay.
1890.
Now I go.
Wow.
Get that history
We heard
lesson
that,
here. Yeah.
and it's actually where I developed the first adolescent program.
Wow.
At that children's hospital. When United Medical Center closed, that children's hospital moved to Beth Israel, and it is there now.
Yes.
But people should not think that the quality of care for children is the hospital.
Okay.
It is the care that, first of all, it's the families and the care that goes on within those families. It's the availability of pediatricians or family doctors or general practitioners who can provide immunizations. It's what goes on in schools. All of those things are very important. So, I still practice medicine. I still practice see hundreds of teenagers a month.
Right.
And most of them, and I think I'm doing a good job if I keep them out of the hospital.
Right.
Because we want to make sure they don't get into the problems.
And it is a national phenomenon that care is moving out of hospitals across the country into the ambulatory space.
Yeah.
So the hospitals are less and less necessary.
Don't say that too loudly.
No.
Well, less
It's true.
necessary in terms of how the care is being provided. We have to now begin.
Well, it's the care that people need because the fear of other things. For example, diabetes type 2.
Right.
The problem is obesity.
Right.
And so that occurs long before people have to come to see the doctor. And if people take responsibility for their own those aspects, what they eat, exercise they do, that decreases the problem. So what we do in hospitals is we treat medical problems. We don't provide help.
We treat the consequence of
failure.
Neglect.
Neglect.
In most cases, because that's what it is.
Now, there may be catastrophic things that happen.
Right.
We just had one.
Well, the trauma unit.
The trauma
I mean,
unit.
that's going to be the biggest
I'm
need.
actually talking about things like COVID. Okay.
Yeah.
So
the epidemic, right? The pandemic.
And that just hit us all of a sudden.
Right.
Remember
medical services across the board.
Yeah.
And looking at it at that reality.
Right.
The purpose is not to seek ways in which the necessity of a hospital exists, but now how do we improve on those type of services? Because people are having a hard time walking in and wanting to get emergency care and not receiving it. People dying in emergency care rooms.
So that's why when I said the emergency care facility at University Hospital is expanding, and people should be able to come into an emergency room within minutes to get that care. That's one of our goals. But even then, it's not most people. Most people don't have to go to emergency rooms. They don't have to go but many people have health problems as a result of other issues. Yeah.
And the challenges that people have to get that health care are things like, how do I get to clinic?
Yeah.
Can I get the prescriptions that I need?
Yeah,
Am I able to have access to the food that I need to do the healthy diet that the doctor told me I should? So all of these things are things that are really important in our environment that actually improve the health of the community.
Yeah, you did mention a very important thing, the prescriptions.
The prescriptions.
The prescriptions, that's a problem.
Really?
Because we're fewer pharmacies.
It's one of the problems.
Yeah, one of the problems. There are fewer pharmacies, and the cost
is
very high. And so people need insurance, good insurance that will pay for the medications and allow them to receive the care. So
we're going to be looking forward to a new administration in the White House and in Trent.
Well, now, since this is Martin Luther King's birthday, it just happened.
Yes, and the reason why I wanted to discuss that in this forum is how critical is the funding for this project in relationship to the new leaderships? What are we expecting from
the merge of the medical school,
is not of federal funding.
Is not dependent on federal funding at all.
And
not even state funding, really, because we have maybe a little bit, but we're just bringing, because we have two things that already exist, and we're bringing those two things that already exist together. So it's not dependent.
But I'm talking about the construction issue.
Well, we have
the construction. Here is not federal dollar.
Not federal
related.
dollars,
No.
Okay.
No.
So we don't see a threat in the vision being forecasted and focused on.
Well, are you asking whether or not there may be problems with the new administration?
The threat to construction is one thing. Other threats are another question.
Wow.
Yeah, because if we have a secretary
how do we help as residents of the community?
Which one of the things? I think it's one of the things we would like is if people have questions about what we're doing, we'd like to hear from them. Because the people, the individuals who know exactly what's happening is Dr. Murtha.
Communication.
So we'd like to communicate with people. And I think that people may have hear things that may be misinterpreted. Give us an opportunity to explain. And so we very, very much want to do that.
And just to say, too, sometimes we learn things we didn't know. So we really do appreciate the opportunity to have those conversations.
Right.
Well, that's good for me to know. Because I'm praying that this won't be my last one. When does the merger take place?
Good question.
So the Board of Governors voted in 22, right? So it's been a year and a half. We have launched the work to get the accreditation. It really is dependent on when we get our LCME accreditation. We expect that June of 2027, if all goes well, we'll receive LCME accreditation. It takes about 2 years to submit the documents. And then they have to come do a site visit, and then 6 months later they'll tell us whether or not they've accredited us. Then we'll begin to recruit the first class. We'll start in the summer of 2028.
Yeah. Wow. So putting this together is an enormous job. We have to have all sorts of committees. We have over 400 individuals who are on our faculty and staff
actively working
and putting this together. So it's an enormous task. Yeah.
So when we're talking about it really reaching its maturity, it's probably 2030 or sometime in that area.
Yeah. The founding class will start in 2028, and it will officially be something on June of 2027, but maturity-wise, I think that's right. 2032 will be when the founding class graduates.
And thinking in terms of it, now as the founding dean of the Rutgers School of Medicine, how does that interact between your role?
So essentially, all that really hasn't changed anything. We are attached at the hip. We are together a lot, actually, having conversations just like this one. It essentially means I'm responsible for the accreditation pieces, making sure all the documents are put together and that we have all of the things lined up for the accreditation process.
Dean?
Yeah, and that's exactly it. But we're going to still need to have people at each school running the operations of the school. And so that's a big job.
And the founding dean title is really just to achieve LCME accreditation. Once the school is created, there'll be a national search for the permanent dean.
Well, the things that are relevant has been really brought into a conversation now. We have ways in which we can now hope that we can stimulate individuals to have an interest and to have a focus on where those interests are. We have really enjoyed this conversation.
Well, we've enjoyed it too. Really, thank you for being here.
Appreciate it.
And please invite us back again.
I definitely enjoy this man.
He's great. It's been
but Dr. Johnson has changed my mind about healthcare. And there are some of my colleagues that actually have him as their practitioner. And we're just so happy about his knowledge of experience being in this community for so long. And I know that he has been a plethora of,
he's been wonderful.
The kind of skill and talent that he has in knowing how
keep
this
going.
was brought. But, and
he tells me all these things too. So.
let me ask the two of you, and I'm not trying to rub elbows either. It's really fun to be in his company because he's such a wonderful person.
100%.
Martin Luther King Jr. Who was he to you?
Oh gosh, to me he was probably one of the most profound leaders we've had in the United States ever. And raising my kids, and when they were in school, they were at a friend's school, a Quaker school in North Carolina, and that was intentional because we really felt like equity and treating people across differences in the same way was a priority for my husband and I. We wanted to raise our kids in that way as well, and that's the way we've lived our lives. That's the way my experiences in California, where we spent an enormous amount of time focused on racial justice and reproductive justice, partnering with the community to develop projects and programs to help improve the health and outcomes for pregnant women in the city of San Francisco, is part of who I am. And Martin Luther King just that's the taking my kids to D.C. and standing on the spot where he gave his speech was a profound moment for myself and for my children. And it's hard for me to express exactly how powerful that was for us, but yeah, he was one of the most outstanding leaders we've ever had.
Dr. Johnson?
Well, I'm a deacon.
Yes, sir.
Chairman of the deacon board.
Praise the Lord.
And King was many things to many people, but the most important thing was to me was a preacher.
Yes. Oh, wow.
It's a preacher.
Lord Jesus.
And he lived the message.
Yeah.
His life was a message about what we're supposed to do. He was an individual who took God's love and said, that love means that I relate to all people. That love means I don't have to be afraid of anything. That love means there are things I have to do. And so to me, it's a statement. He's a statement of what I'm supposed to do with my life, and that's what I'd like to do. So that's, for me, he's a preacher, and that's a very important thing in my life.
That we're all God's children. Yeah. Whatever it is that is keeping us apart, we have to really find a common relationship. And we know that common relationship is our spiritual Father.
That's right.
And we are so fortunate to have individuals who recognize the importance and value of what it means to work in unity. Community or chaos? Well, we know that there is no chaos in this community. And we have two individuals who are really working very hard to continue to ensure quality health care in the state of New Jersey. And we're very happy to have an opportunity to be able to share you with our viewers. And we definitely will be working hard to bring more information that has an opportunity to make an impact on the decisions that you make, the way that you are able to live your life, and to understand how important it is for us all to live together. Thank you so much to the two of you. I really appreciate it.
Thank you so much.
Thank you so much. Thank you so much.
Thank you.
And thank you for tuning in.